Good afternoon. We are talking to Dr. Seena Fazel, who is a clinical senior lecturer in forensic psychiatry at the University of Oxford in England. Welcome, Dr. Fazel.
Thank you very much for inviting me.
Today, you're writing in an article in the Wall Street Journal that there has been a lot of speculation about whether Luffner, the man arrested for the Arizona shooting, has a severe mental illness or not. But is mental illness, you say, a sufficient explanation for his actions? Recent research has found that mental illness is in fact tied to an increased risk of violence, but it is not a simple relationship. Could you elaborate on that, please?
Yes, I don't think it is a sufficient explanation for his actions, but it's complicated by the fact that there's a lot of speculation and myths about the relationship between violence and mental illness. And I think the speculation and myths go in both directions. There's quite a strong group of people who think that mental illness is not associated with violence, and I think that was a view that was shared by many clinicians in the 1980s and before the 1980s. And there's also a view shared by some people that it is particularly lay people, I think, that this explains it. And once we know that this man, if he does have mental illness, if we establish that fact, that in a sense ends the discussion. Now we've found an explanation and we don't have to move on. And I think my view is that it's not a sufficient explanation. At the same time, mental illness is associated with an increased risk of violence, and it's trying to explain how it's associated with an increased risk of violence, and yet it isn't a sufficient explanation that I think is the challenge for experts in the field and journalists and other people who are interested.
You say that only 3 to 10% of all violence in society is committed by individuals with severe mental illness. In other words, as you put it, at least 90% of all violent crime in Western countries is committed by people who are not suffering from such conditions. I suppose a few laymen and journalists would be very disappointed.
Well, I don't know. Disappointed. I mean, these are the facts based on a number of studies around the world, including a large one that I was involved in Sweden, where we looked at all violent crimes over 13 years, and we looked at what proportion of them were committed by individuals with severe mental illness, and we found in Sweden it was 5%. And people have looked in Australia, in the USA, in Denmark and Finland, and the range is, as you say, between 3 to 10%. And I think it's interesting that people have found some consistency, that it's always below 10%. And that's important because it really says that most crime in society is not perpetrated by people with severe mental illness. It's mostly actually perpetrated by young men, and we need to remember that when these occasionally bizarre incidents or unusual incidents come up in the press, and understandably they're reported because they're unusual or bizarre, and so there is probably a disproportionate amount of these more unusual cases where somebody does, let's say, have a history of mental illness or mental health problems. These attract the interest of the press, and I think it's understandable because they're more unusual. They also, people look for an explanation, and here is one simple explanation.
You also put forward the view in the article that it may be that schizophrenia is simply a marker for other factors that increase the risk of violence. And of these factors, you mentioned one of the strongest is alcohol and drug abuse.
I think, again, that's an important and consistent finding over many years in many different countries. And we reviewed the evidence a couple of years ago, and we found that there are 11 studies that looked at what happens if someone has schizophrenia and also a drug and alcohol problem. And last year we reviewed the evidence of what happens with someone with bipolar disorder and also drug and alcohol problem. And in both of these reviews we found that alcohol and drug problems markedly increase the risk. So for instance, the risk can go up to 10 times more than the general population. So what you would find is that someone with schizophrenia, if they abuse drugs and alcohol, compared to someone in the general population who doesn't have schizophrenia, their increased risk is tenfold. So really substantial increase. And one of the issues in relation to this is that we know from lots of surveys that people with severe mental illness are at increased risk of abusing drugs and alcohol. So it's not a simple thing because they are at increased risk. But nevertheless, put all that to one side, it does mean that clinicians in particular can focus therapeutic interventions at people who have these disorders in combination with each other. And that I think is an important implication from this work.
Apart from the alcohol and drug abuse, you also mentioned three other factors that consistently increase the risk of violence in mentally ill patients. Could you enlighten us about that as well, please?
One of the factors that again consistently comes up is the overall extent of people's symptoms. So, for instance, many of these severe mental illnesses, people describe having delusions, which sometimes they can be paranoid or persecutory. They describe a range of other symptoms, including problems with their thinking, with having very fixed, unshakable beliefs, which are not grounded in reality. So when people measure these symptoms in different ways, they find that the more symptoms you have, the increased risk you are of violence. And again, that's, I think, important because it points towards the role that psychiatric treatment can have, in particular medication, and also some psychological treatments which target symptoms. And they also suggest that improving the overall care of these patients would also reduce likelihood of violence. The second factor is a history of either antisocial behavior or problems at school manifested in conduct problems, and also that can also a history of convictions or arrests, and that is again another consistent finding and a very strong risk factor. And a number of people have suggested that, for instance, that we could screen very easily individuals with severe mental illness who are at risk of violence by just using drug and alcohol and this history of violence. And that's a very simple screen. And that will alert you, and maybe you could, as a clinician, then do more detailed assessments of those people. And the third factor, and again, this is work which I've been involved in using Swedish national data, and other groups have been involved in other countries, particularly in the USA, is a family of history of criminality does seem to increase risk, and that is independent, that risk of them themselves having a history of violence or them themselves abusing drugs and alcohol. So this comes out as an independent risk factor, which is again interesting because it points towards some either genetic or early environmental influences on violence in people with mental illness. And that is a relatively new area. We'll need a lot more research to understand more and how it's related to violence in people when they grow up.
Well, obviously it's very complicated. It's not as clear-cut as sometimes these media would like to give the impression.
That's right.
Finally then, with all this knowledge, with the research done, would it be proper to ask what can be done to reduce violence in those mentally ill, where there is a combination maybe of mental illness and drug abuse? What can be done to reduce it?
Yeah. I mean, this is a difficult question to answer. The evidence here is limited because it's often very difficult and very costly to run good quality intervention research. It seems to me that one of the big implications of this work is that we need to think about how to treat people if they have both a severe mental illness and substance abuse, and are there special treatments that seem to be more effective in this group of patients who will be, probably suffering more symptoms, probably more difficult to engage with therapeutically, and do we just use the research that we know works for people with just drug and alcohol problems who don't have mental illness, or is it specialized targeted treatments that we need to focus on? And really the evidence is quite limited, so we don't know, for instance, if certain types of medication work better in this group with these two disorders in combination, or whether there are different ways of administering the medication, i.e. by injection or orally. So this is an important question. I suppose the second thing would be to think from a sort of social policy or public policy perspective in somehow limiting access to cheap forms of alcohol. In many countries, in the UK, for instance, we've had a discussion about very cheap forms of cider and other drinks, and how these some special offers are made to people, and it may be that thought needs to be given about how that is taxed, and whether the duty on the very, very cheap forms needs to be increased to protect people who are vulnerable. And obviously the access to illegal drugs is very complicated. Social policy obviously has a role to play, but it's a very complicated area, and this is a challenge for every country in the world, obviously, and it's an acute problem for mental health services where we have a lot of illegal drug problems, and the individuals with severe mental illness are very vulnerable. They're often picked on for targeted by criminals to purchase illegal drugs. So some thought maybe around how social policy can address this would be important. And I think, underlying a lot of this is that we need to do more good quality research, and I think fostering clinical research, basic and intervention type work is important, because not only do we not know a lot about interventions, but we don't know quite how substance abuse in people with severe mental illness actually leads to violence. What's the connecting pathways? Is it through funding their habits? Is it through disinhibition? Is it through them stopping their medication, their symptoms getting worse? Are there certain types of substances that seem to increase the risk more than others? And that whole pathway, I think, needs also some further work and research. So actually one of the things we can do is actually to foster research in this area, because it's still there's still many unanswered questions. The final thing, I think, is actually just improving psychiatric care for all patients will have a big impact. So irrespective of violence risk, just improving the care will stop the small number of people with schizophrenia and other severe mental illnesses. It will probably reduce their likelihood of violence. And in some countries, that the admissions to hospital is very restricted, and that, I think, is difficult, because you need a bit of time to assess particularly comorbidity with drug and alcohol problems, and to develop a good relationship with patients so that you can follow them up effectively, and then to set in motion good follow-up systems, that they trust you and you trust them to be able to sort of follow any conditions of the follow-up, and what to do when they're not feeling so well, teach them some skills about symptom management, who to contact when their symptoms get worse, ensure that they have good quality housing and other resources for other illnesses they may have, including physical illnesses. So there's a range of things that this group of people needs, and good quality psychiatric services are important to provide them. So I think that's another area. Again, most countries in the world are struggling with high healthcare costs. So I'm not suggesting just pouring money. I mean, it might be that services are just better tailored or more effective at what they do, rather than we just throw money at them. But nevertheless, I think that's a really important implication, is just improving the psychiatric care of all patients. And the final group, I think, that's often overlooked is prisoners. And prisoners are very important because we know they have high rates of mental illness, and they also have very high rates of reoffending. So they're a high-risk group in many ways. And research around the world has found about 4% of prisoners have a psychotic illness like schizophrenia. And again, the rates of reoffending are very high, so it's usually around 50% of prisoners reoffend within 2 years, and a third of those reoffend more serious offences, so violent offences. So the mental health care of prisoners is an area which I think needs particular attention and sometimes overlooked. It can be one of the things that gets cut when criminal justice systems have to find savings. And I think it actually has a big impact in public health, public safety. Again, I think simple interventions can make a big difference.
On quite another note, finally, easy access to weapons, obviously, is part of this as well. Do you have any views on that?
Yes, that's true. And one of the I think implications of the Arizona shooting could be that people think about where the sort of burden is of proving competence or not, because in some countries it's for the state to prove that you're not competent to hold a license, and in other countries it's for the individual to prove that they are competent. And getting that balance right is an area of quite a bit of discussion. And I think my view would be that I think it should be a little bit swung towards the burden being on the individual proving their competence, rather than the state, trying to sort of search through all the records to show whether that you're not competent. So I think restricting access to weapons is important. The exact way it's done is a difficult area, and I think it will depend a lot on local views and cultures, and I think there's no simple solution for all Western countries. I think there will be different solutions for different countries. Nevertheless, the burden, in my opinion, should be a little bit more on the individual to prove their competence than the other way around.
We have been talking to Dr. Fazel, who is a clinical senior lecturer in forensic psychiatry at the University of Oxford in England. Thank you very much for taking the time to talk to us. Thank you.
My pleasure.